when Steve asked me to speak with he and Rob today, I said, sure, until I received from Ali the more information, and I saw this meet the experts. Well, please, I'm not an expert. It'd be quite fraudulent for me to present myself as one. But I've been working for a long time with HIV and PNG, and I hope that experience will make up for my amateur status. I also thought back to ICAP in Melbourne. We were coming to Melbourne to meet, and I thought back to ICAP and the pivotal role that ICAP played in building the national response in PNG and other Pacific countries. I really don't think we can underestimate the importance of that. A very conservative foreign minister, Alexander Downer, but somehow he got what was needed in the region, in Asia and Pacific, in relation to HIV. And supported by Michael Wooldridge, again very conservative politically, but quite a progressive health minister. And it's quite extraordinary, the impact that I think ICAP had. For the first time, many leaders from the region were brought to the ICAP conference in 2003. And honestly, it was the first time these presidents and prime ministers and health ministers have ever met a positive person, ever learned really facts about the disease, and started to realize what impact it might have on their societies and economies. So it's great to be back in Melbourne, and I hope, as Mark Dybel called it this morning, the Melbourne moment, that this conference too will lead us to quite a new place in HIV. So I thought back to 2003, and what was the PNG health system like for positive people then? And what's changed? And I think it's fair to say that the change has been revolutionary. In 2003, there was no treatment available in public health facilities at all. There were just a handful of people who were on ARVs, the drugs being brought in privately from overseas at great cost. Very few doctors knew anything about HIV medicine, and the general health system knew nothing, apart from the fact that the medical wards in the major hospitals were filled with AIDS patients. The leading cause of death in Port Moresby General Hospital at the time was from AIDS-related illnesses. The following year, in March 2004, the government, the health department, supported by Asian Development Bank and WHO, began a pilot project in just 4 centres, 2 government ones and 2 Catholic health facilities, to start treating people. By the end of that year, we had 320 people on treatment. And then came the Global Fund, which was the other absolutely revolutionary thing as far as positive people in PNG were concerned. By the end of 2012, we had over 87 ART sites in all 20 provinces of the country, with over 13,000 people on treatment. And these figures place PNG as the 3rd highest in treatment coverage in the Asia-Pacific region. Officially, it's 79%. Probably it's a little bit less than that, but nonetheless, the figures are really impressive. And then think about that achievement in the context of Papua New Guinea. More than 850 languages and cultures. The terrain, massive mountains and valleys, far-flung island communities, very few roads in the country, the cost of getting services to people, the low rate of adult literacy, less than 60%. Think of the massive training of health workers that has gone on to achieve this testing and treatment program, the planning, logistics, and the money involved. The achievement is all the more remarkable when you look at the health system in Papua New Guinea. We spend only $150 per person per annum on health. Very, very low. Many rural aid posts are closed. We have an ageing health workforce not being replaced at sufficient rate. Maternal mortality is the highest in the region, with 733 women per 100,000 live births dying in childbirth each year. 60% of women bear children without supervision of trained midwives or at a health facility. half of all children are not immunised. There's one doctor per 17,000 people. Fiji has 20 doctors per 20,000. Australia has one doctor for every 300 people. So, we have a very weak health system, yet we've had these astonishing results, really, for people living with AIDS. So, in this context, how have we managed to roll out over 400 VCT sites and 87 ART clinics? Through the sheer determination and dedication of individuals. It really does come to individuals who just don't give up. In the health department, the National AIDS Council, the mainline churches have to be mentioned, especially Catholic, Anglican and Lutheran. Churches in PNG provide probably 50% of the health services, almost 50%, and the mainline churches have come on really well. The nuns dispense condoms, they treat with great compassion anyone with HIV. It's, the official line of the bishops is just ignored and they get on with it. The public launching of IGAT Hope in 2005, which is our umbrella organisation for positive people, really did help the cause. And a small group of people living with HIV just didn't allow the bureaucrats to give up. At the same time, we've had enormous technical and some financial support from WHO and UNAIDS, and huge amounts of money from the Australian government, the Global Fund and the Asian Development Bank. Finally, the PNG government has chipped in with money as well as human resources. For the last 3 years, the government has procured all ARTs, that's no longer donor funded, all test kits and other essential commodities. And slowly we're trying to get the government to absorb all the positions that have been funded under the donor programs into the public service structures. This is quite complicated in PNG because health is a provincial function. We have 20 provinces, so you're dealing with 20 governments and 20 public services to integrate people back into. So that's the good news, but it's not all good news. Treatment rates are low for children, less than 35% being started on treatment. And while almost 80% of adults who need treatment have received it, retention rates are very worryingly low. Some sites have reported dropout rates as high as 25% after the first year, and overall, we think that probably only 45% of people are still on treatment after 60 months. What's causing this? It's a combination of factors. The cost and time of getting to ART clinics, especially outside Port Moresby and Lae, compounded by occasional stockouts of drugs. People get to the clinic and then no drugs, and they may have spent a lot of money and time getting there, so of course they become dispirited. We also have a very big problem with some churches, the Pentecostal revivalist churches, who actively encourage people who are positive to stop treatment, just telling them that God will cure them. And this isn't helped when there's a general, with the low literacy rates, general lack of understanding about health and disease and modern medicine, with a corresponding influence of sorcery and other traditional beliefs. Most Papua New Guineans, you don't have a major illness or die from natural causes. Someone has done something to cause this illness or death. And this affects health in PNG enormously. It's not just in relation to HIV. We have the same problem of drug adherence and abuse of drugs, lack of adherence and improper use of drugs for TB, malaria, and in fact for all diseases. And as a result, we have growing problems with drug effectiveness, probably one of the biggest challenges, I think, in PNG today in public health. We can no longer use chloroquine for malaria. We have very alarming rates of MDR TB growing and resistance to antibiotics. Every corner store sells one or two amoxicillin to anyone who wants to buy them. And people pop them regularly to treat a cough, cold, headache, or minor infection. The other not good news is that we've missed many opportunities to improve the rate and effectiveness of HIV diagnosis and treatment. While concentrating on this major effort to expand services certainly got things moving, their limited integration into mainstream health has resulted in missing many people who should have been diagnosed and treated, people presenting with TB, with STIs, and women coming to maternal and child health clinics. Just to give you some examples, only 60% of women accessing antenatal care receive HIV testing. Last year, only 24% of people going to TB clinics had an HIV test, despite the known very high co-infection rate, and only 12% of those who attended an STI clinic received an HIV test. Health services, particularly outside Port Moresby, are not necessarily user-friendly for many positive people, especially for men who have sex with men, transgender people, or sex workers. So the stigma associated with HIV and the discrimination and exclusion, particularly of some key affected population, are still a huge barrier to accessing services and providing appropriate services. So, you know, if I look at where we need to go, the future focus of the treatment program has to be on consolidating the start we've made by improving the quality and the range of services. The focus has to be on integrating HIV services into the general health system, particularly with TB, STI and MCH services. The third priority, which I related to the first, is to mobilise peer networks of all positive people more effectively and forge partnerships with service providers to improve access to services and reduce stigma. And finally, to advocate more vocally on the role treatment has played in prevention. And it takes me back to 2003. Only 2 positive people came to ICAP from PNG in 2003. There was supposed to be a third, and she is actually here today, but she was prevented from getting a visa in 2003 because she very honestly filled her visa application form for Australia, and when it said, "Have you had TB?" she ticked yes. And so she was denied a visa, but she's learned how to get over that one now by producing chest x-rays. Yeah, she got over TB. But the other 2 women are also both still alive and well. One is living in a village in the Southern Highlands, not featured in the Oil Search film that you may have seen, but living a life very much like the women in that short documentary. And the other one is remarried to a guy who's now president of the Positive People's Association, and they have a 4-year-old little girl. So to me, they're the living examples of effective leadership in HIV. That's what it takes.
Great.
Thank you, Rose.